Good morning, everyone. So at the very outset, I'd like to say that I work in a very resource-deprived environment where all these state-of-the-art facilities may not be available. And this presentation is, it will express my personal experience, and the very little scientific evidence is available at this moment for use of hamstring and autograft in routine basis. So we have come a very long way since when Smiley said that for meniscus, he said, remove all. If it is torn, take it out. Take it all out. Even if you just think it is torn, take it out. And today we are talking about, save everything whenever possible. And because of the available, devices now we have, the technique we have developed of all the shoulder and the knee arthroscopy, the majority of the meniscus tear can be repaired with existing available devices. This was my 23-year-old office worker, pain locking for last 12 months. He underwent meniscal repair 18 months ago, and the recent MRI showed there is a complex tear. After pie crusting, you could see the tissue quality was very poor. There was a major flap which has gone on the back side. So we started removing the meniscus, the poor quality tissue little by little, and the end of the day we landed up with the near complete total meniscectomy. So what to do in this 23-year-old gentleman? There are a lot of options available in literature so far. The scaffold substitute, synthetic implant, and most talked about meniscus allograft transplant. But unfortunately, these are not available, or even if it is available, it's out of the box of the pocket of many of our patients. So when we went to literature, we tried to find out what are the other options, and then to our surprise, we found that in 1993 itself, people use quadriceps for replacement of the meniscus, and this was a case reported, series reported by Khan on 20 patients, 12-month follow-up with very good result. Then fast forward in 2000, there was a 5 cases, 3 male, 2 female, 4 semi-T and 1 patellar tendon, and they showed a very poor result. Probably that is the point when many people thought that autograft is not going to work. But if you go into this paper, there are lots of technical issues. They have used this soft tissue graft in severe osteoarthritis, and the mean age of their patient was 41, which is quite high for my liking. Later on in 2020, after 20 years, lateral meniscus replacement using peroneus longus tendon, this technique was published. And then very recently in 2022, which inspired us also to identify an option of this one, when hamstring graft was used in 7 cases, and you can see this paper with beautiful, incorporation of the hamstring graft into this one. So this is our technique in which we published this technique in Arthroscopy Technique very recently in February 2024. This technique is very simple. Based upon the size of the graft you need, you prepare the hamstring either single strand or double strand. Make 2 tunnels. So this meniscus root has to heal into the tunnel. That is what is very important that we have understood. Then you pass into the posterior tunnel first and the anterior tunnel, and then use a centralizing suture so that you fix into the periphery, and then use whatever device you have, all inside, outside in, or inside out, to fix the meniscus rigidly into the periphery. So this is the video. You see the most important one is the applying a centralizing suture, which will give you an intra-articular view of where the central of the graft is. This is the posterior root tunnel which has been created and then shuttled with a Prolene suture, which will act as a suture shuttling device later on. Then we create the anterior tunnel as well. In earlier technique, the 2 tunnels were not created. We thought that anterior and posterior good anchorage is vital for healing of the meniscus. So both the tunnel have been created, the suture are taken out from the anteromedial portal. Now this graft, what I do is I pass completely this hamstring graft through the posterior tunnel, because I feel that if it goes through the marrow of the proximal tibia, it will come up with some growth factor which will again help in healing of this meniscus. Then once it is inside there, then you pull into the anterior tunnel, see the centralizing suture, and use this centralizing suture to stabilize your graft into the periphery. Then it's up to you what type of suture repair device you want to use. You can use in my hand, outside in and the inside out are very commonly used technique for this one. And at the end of the surgery, you feel that such a flimsy, replacement for such a thick and big, meniscus. We thought that this will not work. But to our surprise, we relooked in the same patient after 8 months. And you see, after 8 months, such a flimsy tissue has taken the shape, triangular shape of the meniscus. And then it surprised us, by the capacity of remodeling of the hamstring into a meniscus-like tissue. So this patient is already on 18 months follow-up now. There is no progression of osteoarthritis. We can still see some signal changes in the meniscus, but the shape, you see the triangular shape of the meniscus is regaining in this particular patient. So to conclude, treatment of meniscal injury have evolved a lot, from excise all to repair all. Now we are talking about if you cannot repair, probably you have to replace it. Meniscus allograft transplant is an established procedure, there is no doubt, but has several limitations, especially in our part of the world. Autograft transplant is a new process. Hamstring for meniscus has shown promising early results. We have done 9 so far, and we are still following them up with only 1 complication. Technique and treatment option may vary based on the individual situation, what are the device you have. Thank you very much. Thank you.
Thank you, Dr. Amit, for an excellent thinking, excellent job. And I think we have heard this from you many a times, and you are a great proponent, and congratulations for publishing this in the arthroscopic video technique.
Thank you, sir. Thank you very much.
How all the 9 patients are doing? They are doing good.
Sorry?
All the 9 patients which we have.
Yeah, out of these 9 patients, 7 were for medial meniscus, 2 were for lateral meniscus. And if you understand the position of the lateral meniscus anterior root, it's quite near to the ACL, and that was associated with ACL as well. So in that case, the patient developed a cyclops lesion in the ACL. That's why we had to debride the cyclops. But the meniscus was improving well, but because of the flexion extension deficit, we have to debride. That is the only complication we had. Otherwise, there is no such complication.
Generally, only in young patients you are doing this.
Yes, my mean age is less than 25.
25. And what is the longest follow-up?
18 months.
18 months. Okay,
Thank you.
Thank you. I think no more lecture in this session. Thank you, the organizers, for